Hi, I'm your host, Dave Kemp, and this is Future Ear Radio. Each episode, we're breaking down one new thing, one cool new finding that's happening in the world of hearables, the world of voice technology. How are these worlds starting to intersect? How are these worlds starting to collide? What cool things are going to come from this intersection of technology? Without further ado, let's get on with the show. All right, so here we are. We're joined by Devet Swanepoel. Devet, how you doing today?
Good, thanks, Dave. It's good to be with you.
Good. So tell us a little bit about who you are and what you do.
Dave, yes, so I am a research audiologist. My day job is as a professor of audiology at the University of Pretoria. I also wear a couple of other hats. I'm also the editor-in-chief of the International Journal of Audiology. And I am also a co-founder of the HearX Group, a digital hearing health tech company, where I serve as a scientific advisor as well.
Very cool. Well, yes, like you said, University of Pretoria. So I'm really excited to have you on to have this conversation today, but you're also helping to round out my map of guests. So now I have a guest from South Africa on, which is really cool. So the reason I wanted to have you on today is I think you have a really fascinating story about, how you kind of came into this audiology industry. And, because I think you're based out of South Africa, particularly with HearX Group, you've kind of have this very remote oriented mindset, I think, as you deal with people in the US and other parts of the world, obviously you're not in person. So I think you've always sort of been a little bit hamstrung a little bit in terms of having to get creative with the, your ability to meet people wherever they are. And I think that's really kind of translated into all the work that you're doing with HearX. And, with this podcast, I've had a number of conversations on here, really going back to the start of the pandemic around, the rise of telehealth and remote services as a whole throughout the healthcare system, but specifically talking about this industry. And I wanted to continue that conversation today with you because I do think that you're on the forefront. So why don't we start with HearX Group? Can you share a little bit about this company that you started, what the vision is, and sort of where you are today with this company?
Sure, Dave. That's a long story. I can go back a long way if I really want to start right at the beginning. Look, my area of research interest has always been around accessibility of hearing care services, and you're absolutely right. When you come from a context where there's such a scarcity of access to services, innovation is kind of out of necessity, right? So you need to come up with innovative ways of trying out new models. And very soon in my research career, I realized that really to make an impact that's bigger than just the kind of incremental addressing of hearing loss, we do need to turn to digital health technologies. The connected world, was really kind of the influencer of change in low and middle income countries in Africa. I think of the kind of the mobile operators. They really changed the landscape in Africa entirely in industries like banking and agriculture, and certainly it's starting to happen in hearing care, and I just felt that it should also happen in not just in health in general, but also in hearing care in particular. So HearX is kind of born from the research we did, over the past 10, 15 years. It's a tech spin out from the University of Pretoria. We developed a couple of patents and some IP that was then spun out into a digital tech company that was founded towards the end of 2015 and started operating with 2 employees in 2016.
That's awesome. As a side note, I just find it fascinating, particularly with emerging markets. like you mentioned with the mobile, kind of the dawn of mobile computing. And, you look at places like Africa, India, they're not really inundated with a lot of legacy systems. So in many ways, they can leapfrog kind of into these new technologies. And you see it with, like you said, mobile banking it's huge in a lot of these parts of the world. And I think that actually ties into this conversation because so much of the probably the biggest limitation to adoption is the mindset of, well, this is how we've always done it, both from the patient and also from the provider. And so I do think it's kind of fascinating when you look at parts of the world where maybe that mindset didn't really exist because it was such a raw market in a sense. And so then you introduce sort of like the successor to the technology or the systems that exist in these more developed countries, and they're not having to transition and deal with all the incumbent legacy systems and processes. So I always find that really fascinating, where you kind of tend to see some of the most advanced technology being most rapidly adopted by some of these emerging markets.
You're absolutely right, Dave. So, in a way, the leapfrogging means you're not bound by the traditional kind of constraints of thinking about service delivery in the old-fashioned way of doing it. And that's typically, the way in which clinicians often operate, and all of us are like that. But we do things this way because it's always been done this way. And sometimes if there's actually no service infrastructure,
Right.
it gives you the freedom to actually innovate and come up with new solutions. And it's just because the mega trends have also kind of combined at the right time. Connectivity has penetrated all areas of the world. We're oversubscribed in terms of mobile penetration rates around the world. But at the same time, we've seen this digital revolution, the fourth industrial revolution taking place at the same time. And so there's this convergence of technologies and connectivity that's really exciting in terms of the solutions that are possible. And then at the same time, maybe, just to sketch the bigger context, if you look at a continent like Africa with more than 1 billion people, and you realize there's a prevalence rate of hearing loss of, around 7%, and less than 3% of people who have hearing loss actually are able to access hearing aids. You realize that, existing models are not delivering the care that people need. So it necessitates innovation.
Yeah, no, I think that's actually, it started out as a tangent, but I now realize like how much this will pertain to our broader conversation because, you look at, somebody in Africa or India, maybe the first computer they've really ever interacted with might be their phone. And that's actually a pretty profound thing to think about when you put it at scale, because, suddenly you're kind of opening their eyes to the possibilities that exist, and they're sort of operating at that mobile first mindset. And, so you say, well, most Android, even a $20 Android phone, it still has a semblance of connectivity. And so for the types of hearing aids that are starting to really come onto market, they might not be up to the same caliber of, the high-end hearing aids that we see here in the States, but like you said, these mega trends that are converging together are enabling, I think, they're kind of setting the stage for widespread accessibility. Finally, finally giving us the ability to serve at scale a lot of these underserved populations all around the world. And again, that's why I think your company is really interesting, because most of the conversations I've had have been very US specific, but when we look at this as a very global problem, I'm sure there are tons of different World Health Organization stats out there that say, the prevalence of hearing loss across the globe, it's, if you apply these figures, these percentages, if it's 10%, 15%, we're obviously looking at billions of people. So how do we make it so that this type of technology sort of fits into these macro level trends and can be part of that solution? And so I think with HearX, what's really interesting is because you're, based out of Africa, clearly you're going to always be somewhat focused on the US market, but I think some of the international growth is probably really exciting to you all as well. So is that, I mean, how do you look at all of these different markets and kind of both from the like a business perspective, but also from, like you said, your core mission being accessibility driven?
Yeah. Yeah, Dave. So, I mean, it kind of comes back to the vision of HearX. So we started early on, and we realized we need to be a vision-led company. That's the reason we started. So our vision is healthy hearing for everyone, everywhere. It's a big vision, but we believe, with these types of technologies and being partner-centric, it really should be possible. We have everything available to us to see that vision become a reality in the next couple of decades. So we are impact-driven startup or scale-up as well. So we really chase impact. We want to touch people's lives, as many as possible. And like you mentioned, we started out, on the continent of Africa, but now we have products that are used by different groups and government organizations in more than 39 countries. So it's quickly spread. And the interesting thing is, we developed it for the kind of low and middle income country context to be accessible and affordable. But very soon you realize that these mobile solutions are actually also very relevant and needed in high income countries. So it's actually been a bit of a pull factor that's pulled us to the US market, right? So and at this stage, that is one of the big markets where HearX is growing and doing some interesting things with new models, but also in line with affordability and accessibility of hearing care to individuals.
So let's talk about some of these products that you alluded to there. I've looked at, poked around on your website, and I've just kind of come across some of the different things that you have. So you have, the hearing screener. Let's start there. Talk about this, because I know that you guys just passed a pretty cool milestone with 1 million hearing tests. So talk a little bit about this, because I believe this was probably one of the first products that you guys developed.
Yes, exactly, Dave. So, the way in which we want to operationalize this vision of healthy hearing for everyone everywhere is really to set ourselves the mission of providing affordable access to hearing health using digital solutions that anyone can use anywhere. So this has been our philosophy. So it should be extremely high-tech pieces of equipment or devices that are always connected, or that at least should connect at some point in time. But they should be so simple to operate that anyone, should be able to actually operate the device and facilitate the test. So that's kind of the philosophy around how we started out developing our technology. So our first hearing screening device called HearScreen, we really started developing in 2013, and our aim was to use the least expensive or the most inexpensive Android phone at that time. It was a small little device that almost looked like just a feature phone. And we said we can make pure tone audiometry screening work on that with calibrated headphones. Then we know we could, make it work on any platform. And eventually we got that right. That was the first technology, and it was called HearScreen. And it was developed so that lay health workers, teachers, nurses can operate the device, do a test in unconventional environments, primary healthcare clinics, schools, early childhood development centers. We utilize the sensors of the device to ensure we do very good quality control. So because you have lay health workers or lay persons doing the testing with minimal training, you need to be sure, if you want to rely on the results, that you're doing lots of quality control, utilizing the technology at your disposal. So for example, we calibrate the microphones of these devices so that we actually can measure the environmental noise accurately in real time while you're doing the test. So that's a quality control metric that is captured in real time and synced to the cloud. So an audiologist can remotely review the program. We also do things like, we track false positive responses. We track the quality index of the operator doing the testing. And we do this in an ecosystem that allows us to sync seamlessly from a mobile device into the cloud-based platform. as an electronic health record system, so that you can have program managers that can then monitor the quality of these programs remotely, and that's really the teleaudiology concept, right?
Yeah, no, that's the way I view it, is that, this ability to, like you said, I think provide lay people, if you will, with something that is kind of foolproof, and it allows for you to facilitate these kinds of services in a way that you're confident you're going to ensure the right results. And so if you've done a million of those tests, I mean, where was some of the initial uptake, and are all of these administered through like a handheld device, or some of them done through a website? Just help me to understand what comprises this million tests.
Yeah, and I kind of just started with the initial device, which is a medical grade pure tone audiometer, in essence, that functions on an Android device with a calibrated pair of headphones. That's called HearScreen. But
Okay.
we have a number of different hearing test products, and this million tests have been conducted across all these platforms. So we also have a diagnostic version of this test, which is called HearTest, which is to conduct pure tone audiometry, and extended high frequency pure tone audiometry. And then we also have other options that are web-based. So these technologies I've just mentioned to you are technologies where we provide, or HearX provides, the smartphone calibrated with a pair of headphones, preloaded with the software. So those apps you can't download. But we have also been working with various colleagues and partners around the world on developing digital noise tests, where we provide them as apps and as a widget that people can embed on a website, which allows for online hearing screening or app-based hearing screening. In fact, we launched the first version of this as the first national hearing screening test that you can download as a freely downloadable app on iOS and Android, called HearZA, which is the South African National Hearing Test. And it was such a success. We launched it in 2016 that we've worked with partners to launch several other iterations of this. And in 2018, we launched HearWho for the WHO, which uses our technology, and we provide that solution for them. And we're now working on expanding the different languages so that we'll support 6 languages in that app towards the end of this year. In fact, on the 3rd of March this year, we'll add Spanish and Mandarin to the HearWho app.
That's awesome. So this idea of embedding a widget really catches my attention. A lot of the conversations that I've had on this podcast or outside of the podcast have sort of been like this. The pandemic hits in March, 2020, and it became apparent very quickly that we need to adapt as an industry. And I think telehealth sort of becomes a primary focus for not just the hearing care industry, but by and large for healthcare in general. And, so I think a lot of people were pushed outside of their comfort zones and were looking for, okay, how do we, what are these kinds of things that we can provide in a no touch or a low touch type model. And I want to really get into that a little bit further along in the conversation. But, I think that what happened though is, obviously there was a necessity to innovate. And, you can, one of the ways that we'll probably look back at the pandemic in hindsight will be it's the great accelerant. It took some trends that were probably in their incubation periods that were on a trajectory to grow, but it just accelerated them big time. And I think telehealth will be one of those things, because I think it made it apparent that, okay, this is something that we need to fully wrap our heads around and figure out how do we go about implementing something like this. And then, as the fear started to recede into the summer and patients started to come back into the clinic, I think a lot of people felt, well, I'm going to just revert back to the way that I had been doing business because it's just what I know and I'm more comfortable, and being uncomfortable kind of sucks. And so, but I think that there were a few things that happened even in that small window, that are going to become relevant for a long time moving forward. And I think that these this idea of having a widget on any website, if I'm a provider and I have my practice's website, this to me seems like just a no-brainer. Put something on there where, at home, you can take a quick little screener and that will give you a sense of like, do I need to continue to pursue this? So is that kind of the thought here? And what has been like some of the conversations that you've had with folks, providers that have been, embedding these, your screener on their website?
Yes, Dave. So that's absolutely, the way we've also been seeing the trends evolve. I mean, we've developed these technologies way ahead of COVID-19, but suddenly when COVID-19 came, it's suddenly like they just fell into place.
Right.
And providers suddenly realized where they fit in and why they're so important. Previously, people are so hung up on doing things the way they've always done, but as soon as a crisis hits, it really kind of helps people to rethink and be inventive. So our Digital Noise widget, one of the things I should probably say is because we've kind of a tech spin out from the university and we work closely with academic institutions, everything we've done is validated. So we have a long list of more than 30 peer-reviewed publications that have validated all our technology. So I think that also differentiates our widget, our online hearing test, from many of the others that, you could put a hearing test on your website that has no validation and there's no data to support it. But this digital noise test has been widely validated, and that's why the WHO also has implemented it. And in fact, we've partnered with a number of big organizations. I'm thinking of 23andMe, who have also implemented our widget, and I think they've done more than 300,000 tests on their widgets for people who are doing their genomic screening. So, and that's an exciting research area where we also involved in to see how can we link different genetic variants to your performance on a hearing and noise test.
Yeah, that's.
But in any case, to get back to the digital noise screener that you put in a website, I mean, for clinicians, it's a wonderful way of actually marketing your practice. You're putting a service out there that's free of charge. People can go and do a validated, reliable screen in less than 3 minutes. And of course, it's a lead generation tool. So audiologists can utilize that to generate leads directly into their practice. And it's a great tool to also, capitalize on that with your digital marketing campaigns on whether that's Facebook or Google SEO, so to really get traction and get people's attention. So the widget is linked into a back-end portal, which we call Leads. So the test, you can customize the test with your logo and with the various kind of colors that kind of fits your brand. And then when someone finishes the test, they can leave their details, and you get a ping to look up their details and then contact them.
Yeah, I mean, I'm so glad that you mentioned the lead gen side, because from a business standpoint, this is a tremendous lead generation tool. And I love that you mentioned too, like making this part of a digital campaign. Like I can already see it, a Facebook ad that's like, get your hearing tested in 3 minutes, or, get a screening, something. And I agree with you where by the audiologist for the audiologist. I think that's extremely important that this type of tool is being developed, from audiologists who are doing this through the interest of like, we understand the importance of providing a valid test. And so I love that. I think that's such a great actionable thing that any practice that, anybody that's listening to this today, get in touch with WET, because this is something that you could put into your website overnight. And, I think it's so cool that you already have the back end system where you're just feeding them leads, hey, this person just took a test. These are hot leads that you can then follow up on and be like, hey, I see that you just, provided this, and or you just did one of these hearing screeners. And that, I guess, is kind of a good segue into where I think this kind of can go, is more of like a click to chat option, right? And I want to get into your thoughts around the reason I initially found you, I've heard your name a number of times throughout the industry, but what really caught my attention was the piece that you wrote. I think it was it was either the Hearing Review or the Hearing Journal, and it was about no touch and low touch models. And it was like right in April. And I remember reading it and I was like, this is it. This is a really sophisticated way to be thinking about how to do business in a setting where you literally can't interact with somebody face to face, or maybe you can, but just a little bit. And so I'm just curious to get your thoughts as somebody that thinks about this day in and day out. If you're already capturing somebody's, attention, and then they're providing you with their little results through this rudimentary thing, it seems the next step would be, let's really have that consultation. And you're putting a bit of an onus on that person to say, you need to come and visit me in person. I mean, if you're using the analogy of like, the game of baseball or something, you're just setting yourself up with like two strikes. You're limiting your odds of actually seeing that person because you're providing them with another excuse to say no. They'll say, well, there was absolutely no friction for me to take that hearing screener on your website that took me 3 minutes. But now, not only are you asking for a time commitment, but you're kind of asking for an emotional commitment too, because you're making me recognize that I might be perceiving a problem that warrants me to take 2 hours or however long outside of my day. So I kind of tend to think that if you can make that less of a commitment from the patient, where they say, okay, I've committed 3 minutes to this, now I can commit a 20-minute Zoom consultation, but it would be through some sort of HIPAA compliant platform. That to me seems like a really actionable thing that, again, practices can start to implement, not necessarily at scale and say, this is how the end all be all, this is how we're going to do business. I kind of like the idea of a hybrid model. But again, part of what the pandemic did was it highlighted the need for these kinds of things in certain situations. And so you kind of can slowly put your foot into the water and say, all right, now we're going to start to flesh out what this aspect of my new service offering would look like. What are your thoughts on this?
Yes, Dave, you raise a lot of very interesting and very valid points. So, I mean, there's a very interesting world out there of research in terms of how do you convert a lead, and get someone to actually make an appointment in the practice. And really, I mean, here you're absolutely right. We've developed this software with the audiologist in mind to see how can we support them, how can this technology help them to build their practice. It should be a tool that allows them to really maximize their reach, and it should be available to the small guys as well. You shouldn't be a multi-site practice to be able to utilize this technology, right? So maybe I should say the first thing is to generate a widget is extremely simple. You can go on the website, you choose your package, you can put your logo on, you can choose your colors, and then you literally generate a little bit of code. It's a code snippet, and you could put it into your own website backend platform, or get your web developer to do it, and then it opens up a frame that has this test run in your website, but it looks exactly like it's embedded in your own website. So that's just to say it's very simple. It doesn't take any technical guru to actually do it. Even I can do it. So that's the one thing, but the integration and the conversion of leads from, when someone's done the test, how do you convert them? Because it's one thing to do the test, and we've done a number of studies to see where the drop-offs are. So some of the things we've done is to optimize, the different pathways. And audiologists can also choose how they want to set up the widget and the results. So one option is to, before you view the result, you ask for their details, and it's so that you can send them some information about healthy hearing habits, for example, right? So, or you could give them the result first and then ask for their details if they want it. What we've also done is some bespoke solutions for certain, bigger practice groups, where you can, after you've done the test, make an appointment directly into the practice. So the widget integrates with practice management software. So, and of course, that's actually the best way to do this. And then to have the functionality of a chat function. So if there's someone who can manage a live chat in real time, then that's an option to include in the bespoke widget options.
This is all just so great because I love, first off, I love that you mentioned that this is for anybody, like any kind of practice out there. And really, again, I keep talking about like the pandemic, but I think that, this is going to necessitate a whole lot of new services and therefore service providers. And I think it's really cool that you're building this with, the mom and pop practitioner in mind that might just have one practice, because I think that we need to provide all of these different clinicians with tools so that they can, I think it wasn't as if people said, I don't want to necessarily embrace all of these telehealth options, these remote services. I think it was more like, okay, it kind of exists. And first off, I don't know where to even begin. And then second off, I don't have the processes in place to really fully implement this into my practice. And so I think it was kind of like a, fly by the seat of your pants. But I do think that that's a really important thing. And I love that you mentioned, this idea of having a chat system in place. I mean, in my mind, if for a professional out there and practice owners, I think that the way they can be thinking this is like just one piece at a time, right? You need a chat option, a click to chat option. Do you integrate Facebook Messenger onto your website, right? Is that the chat system that you prefer? Does your web service host, do they have that option? Regardless, I think it's an awesome thing to be thinking about and pursuing, because to your point, all of these things start to then become a cohesive offering, right? You take that screener and then you immediately get hit with an email or something that's automated where the practice, it's just not a lot of burden on their end. That's how this is, I think, ultimately going to really become adopted at scale in this industry, is for a lot of these new vendors, I think, or existing vendors, to make it so turnkey and simple for the practice owner to just turn it on, and it's really, really easy to then integrate into their practice.
Yeah, exactly, Dave. And one of the other things, it's not just the fact that you get a hearing test result on these patients. We also ask a couple of questions. And one of the important questions we ask people who take the screening test beforehand is based on a staging algorithm that classifies them in terms of their readiness to take action. So that way we classify on the back end the readiness of this lead. So you can actually prioritize those people who are ready to take action. They're not just thinking they may have hearing loss, and the hearing test may indicate that they do have some kind of problem, but they're actually ready to take up an intervention. And those are the people that you want to contact straight away. Your discussion with them will be very different than your discussion will be with someone who says, I'm thinking about a hearing appointment or a hearing loss. So you can really tailor and personalize your approach as well based on the results you get on these consumers really who finish this test on your website. So it's not just the hearing test. And of course, it's a screening test because it's online, but in fact, the audiologist on the back end gets a signal to noise ratio. And because we validated all this normative data, it's really a diagnostic value that you can utilize to determine the severity of this person's hearing loss as well. They only get it as a screening result, but you as the audiologist get a detailed result on what their ability is to hear speech in noise.
Yeah, I think that's really cool. Again, the robustness is only going to grow, I think. I think that if you look at the broad trajectory here, you can see that this is only going to become more robust in time with the type of data that you can get and the type of insight that you can gather. I just recently listened to a very interesting podcast with the founder of Teladoc. And, I think it's important for anybody that's thinking about this stuff to really get an idea of what's happening in the broader healthcare system, because there's two things that are really happening. First of all, the behavioral shift, right? So you have to look at the way that people are thinking about, one of the biggest limitations that he cited with telehealth in general prior to the pandemic was the more or less the adoption of video chat. And it was a foreign concept for a lot of people. But one of the things the pandemic has done is it's ushered in a very high level of widespread competence of how to use Zoom, Google Meet, all of these different things. So there has been a major behavioral change in terms of how people access these kinds of video chat services. And the other thing he said, and I'm going to tie these two together, is he said, we don't have a healthcare system. We have a sick care system, and we have a tendency to just treat people when they're sick. And that's why I love what you just said right there, where you might have some people that if you can give them a more approachable entryway into your entree of services. So not to say the only reason that you should ever contact me is if you feel as if you need a hearing aid, that really sort of puts you at a disservice for if that average time span, I saw it went from being 7, now they're saying 10 years between when you recognize you have a hearing loss and when you take action on it. So what about all those people that are in that 10-year gap? And I think that what you're talking about here is this ability to appeal to those people where you're not necessarily saying like, look, you're going to schedule time with me and you're going to fall into my funnel of leads and you're going to work your way up to, I'm going to sell you a hearing aid. I don't think it needs to be like that. I think that it can be, let's just get you a consultation to have a conversation about where you stand. And as these types of remote tests and screeners become more robust and they have, a higher yield of insight. And so you can have a conversation to say, look, this is maybe where you have a little bit of a deficiency. Here's the types of things to watch out for. And so again, you have a population of people that are becoming way, way more adept at these kinds of consultations and video chat and all that. And then in addition, you have a lot of people that are becoming way more health conscious with this preventative health mindset where they're saying, I don't want to wait until my hearing is shot and all this. I would rather have a conversation today about how I can preserve what I have. And that to me is like what all of this sort of turns into, is it becomes something that you're kind of appealing to a totally different type of patient than I think most providers have ever really seen before.
Yep. And I like the way you've put that, Dave. I mean, we're reaching a different cohort of people online, but that cohort has also dramatically increased over the last year, right? With the entire COVID pandemic changing, digital habits entirely. And I mean, a recent survey I saw from Ericsson Mobile, a connectivity report they sent out, they did a large survey in the UK and the US, and they asked people, what are their views about physician consultations in the future, considering what the COVID pandemic. And 6 out of 10 persons in the UK and the US said that they predicted that virtual physician appointments are going to be more popular than face-to-face appointments. I mean, I think that's a massive shift, right? So people are shifting towards this kind of virtual platform. But this is also, in lieu of what you said, this is also where the clinician becomes so important, right? I mean, the test is great to have, but in the end, it's the clinician and their ability to connect to the patient
100%.
and advise them. And what we've found is that, this is just a tool to get you talking to a patient. And ultimately, that's where, it's become so important as a clinician to differentiate yourself and not just be a dispenser, but actually be a clinician who connects with the patient's needs, understanding where they're coming from, the whole person-centered concept of care. And maybe it's worth just kind of making a mention here of some very useful teleaudiology tools as well, that are provided by the IDA Institute, and they're also free of charge, and you can actually embed them into your website as well, to help patients prepare for their first appointment. So typically what we would recommend is you have a hearing test, you have a consultation with them, send them the link to some of these tools to prepare for your first appointment. And it helps the patient to actually think, reflect about what's going to happen, but also about, the potential treatments and the potential upsides of coming to an appointment ready, so that they can make decisions there that are in their best interest. So I think you've touched on an important point here, that the person-centeredness of these approaches are really great. And sometimes people think that technology is opposed to that clinician,
Yeah.
approach. But I think they work beautifully together, hand in hand, to support each other.
Well, I love that you say that because, I don't look at this at all as like a replacement or anything like that. I think that this is ultimately a way to amplify and extend your value. I think that the providers that really grab the bull by the horns here and adopt a lot of this will more or less just be able to facilitate their services that much more. I mean, I think it's going to create a massive surge of efficiencies, because again, it's not to say that you won't have face-to-face visits. I don't think that's going away anytime soon. A lot of people prefer that method, but you're tapping into the portion of people that would love to just have that 20-minute consultation with you. And at the heart of this whole thing is, just like you said, these tests and screeners and all these different tools, they're just a means to gather more information, to have a more comprehensive conversation, I think. And, so it's not as if an algorithm or, some online player can just come in and disrupt that, because really what we're talking about is the knowledge and expertise that comes along with years and years of being in this profession and harnessing, really the wisdom that comes with being a professional in this space. So you're not talking about disrupting that value per se. You're talking about creating a means to extend and amplify that value. And that to me means that you're going to be able to just charge more for, you'll be able to, if the cost of hearing aids continues to goes down, which I'm sure it will, and you're looking to compensate for that revenue that's not going to be there. It seems like the thing that will be in high demand for in an increasing amount of demand is going to be that consultative. I need to have a conversation with you to even understand where I stand, and building those relationships over time. Some of those people might end up buying something from you, but a lot of those people, in terms of how they're customers, more or less, you're going to bill them for your time.
Yeah. Yeah, exactly. I mean, I think you're touching on some of the sensitive points for the audiology industry at the moment, right? Where does our value lie? Is it in doing audiometric assessment, or is it in providing a hearing aid? And I think, yes, all of those things are important, but at the heart of what's most important is that we are professionals providing professional service, and our consultations and our time should be valued as such. And I think, technologies, in my view, should be there to allow us to do all these technical assessments and all these provisions of hearing aids very well, but they should also be there to free us up to really connect with patients, understand where they're coming from, and providing them with the care that they need. We know patients with hearing loss, it's not just a matter of putting on a pair of glasses, right? If you put on a pair of hearing aids or amplification, it has to be personalized, and it goes along with a lot of hand holding and support, and that's really the value of the clinician.
Yeah, no, I couldn't agree more. So you have the hearing screener. Let's get into a few more of these services or product offerings that you have. I love this theme of empowering practices. So what else falls along that same vein as the hearing screener?
Yes, so the hearing screener and on the online widget is a good example of kind of on the continuum to reach new patients, right? And that's important. But if we think of, how do we take the next step to do some kind of diagnostic testing, especially in a COVID world? We kind of combined a lot of the technologies that we've developed during COVID-19 and produced a new product offering that we called the self-test kit, that was developed particularly to enable low touch and even no touch models of audiological service delivery. And what we did is, it's a tablet based device with a calibrated pair of headphones, that can be sent out to someone's home. Very simple to open it up, put the headphones on, and then go through a comprehensive assessment of hearing. So it's not just a screening. So what we do there is we do a pure tone audiogram. So they get instructed, and it's a self-guided assessment. So someone can do this by themselves, or if they have a significant other in their home, that person can also support them to do the test. But it does this pure tone audiogram, and then we do a speech and noise test as well. So a digits and noise test right after that. And we developed a proprietary algorithm during COVID-19 and we've just published it in the International Journal of Audiology, that then utilizes the speech and noise result, your pure tone audiogram, and using a logistic regression analysis that also incorporates the age of the person. We can then determine whether they have a conductive hearing loss or whether they have a sensory neural hearing loss. So in other words, you can test outside of conventional environments. You don't have to do this testing in a sound booth. It's in someone's home. It could be a curbside assessment or a drive-through type of assessment to really reduce the time and the risk for some of these patients. And then the idea is that from there, you can prescribe a treatment for these patients. You can either see do they have a medical issue, which is the minority of these subjects, and they could be referred to a medical practitioner's office, or if they have sensory neural hearing loss, you could already have a discussion with them about the types of devices that are available, their fitting ranges. And if they are willing to trial a device, you could actually set up a device pre-fitted and have them, come in for a very quick assessment where you just put on a device and then have them go for a hearing aid trial. And that's a good example of a low-touch model of care, right? So the assessments may happen outside of the clinic. They may come in for a very quick fitting of the hearing aid, and that's it. So it's one appointment, and then they do the trial, and then the support can be done remotely. So the self-test kit has been really popular during COVID-19. It's widely used, and it's really has filled the gap. Traditionally, teleaudiology models, allowed for the screening and the support of existing patients, but it's that gap in between. How do we provide an assessment for new patients in a remote way, or in an unconventional way outside of a clinic?
Yeah, no, I think that's really, really interesting. So let me understand this. So you send out this self-test kit. Does there need to be a professional on the other end of it while they're doing the test, or is it all done by the patient on their own, and then the test results get assessed by the professional?
Yeah, that's a good question. Let me clarify. So there's two ways in which that can be done. The one is it can happen, where they literally open it up, they go through the instructions, they do the testing. It takes about, 12 to 15 minutes to run through the assessment. And it syncs back to the cloud, and the audiologist can remotely review the results and then connect with the patient and provide them with a consultation. If the patient has difficulty in the setup and they have difficulty, understanding in the instructions, the audiologist can connect in real time as well with them to support them and talk them kind of through the instructions. In our experience, that's very rarely necessary, but that's certainly an option. The idea is it should also free up the time from the audiologist so that they can then schedule an appointment slot to have this discussion with the patient. So in terms of the type of hearing loss, the degree of hearing loss, what kinds of treatment options are available, and that way the audiologist also comes at the appointment prepared, right? And so they can make the right recommendations, take them through some examples of samples, and that can obviously be done virtually, to reduce the risk.
Yeah, no, that makes a lot of sense. I think it's a really fascinating way to, again, sort of create efficiencies. Like you said, administer the test to where it's so easy they can do it on their own, and then you have that conversation afterwards. So they still feel like there's a significant amount of value of working with the provider. Not to mention that they got this very professional looking test administered to them. So it goes again to this notion of like, you have to create an experience in today's day and age with big box retail, with all these online players, that is unique and that puts the provider's value front and center. And I think that totally does. So the other thing I wanted to talk about briefly is Lexi Lumen. So you guys did just launch a line of your own hearing aids, I understand. So can you tell me a little bit about the goal here with these hearing aids and kind of what's happened so far since you've launched them?
Sure, Dave. I mean, the solutions we've been discussing up until now, and there's a number of other solutions as well, cool ones that's always interesting to talk about, and maybe at some other point we could do that. They're all intended for the clinical space. So for audiologists to support them in their practice, maybe other healthcare providers, ENTs, general practitioners, but then also lay health workers, community health workers, etc. So it's a clinical, they're clinical solutions. They're FDA approved. The company is ISO 13485 medical device certified company. So all of those are kind of our business to business solutions.
Yeah, that makes sense.
That are intended for
enterprise
professionals. Yeah. So what you've mentioned now is kind of our foray into a direct to consumer service provision, and we really, it kind of fits with our vision of healthy hearing for everyone everywhere. Initially we started off with screening, diagnostics, and now we've moved into providing intervention as well. So we're able to actually combine those test results and do a fitting of a hearing device based on our technology. So we've always had that in mind. This is our first foray. So Lexi Lumen is a direct-to-consumer hearing care service. We believe it's a comprehensive service, so it's not just providing a device, but it's actually providing a comprehensive hearing care package to consumers. We know there's a vast number of consumers already searching online for services, right? So these are people who are probably not the guys who are going to come into a clinic. They're probably not there yet. They may have milder hearing losses, mild to moderate hearing losses, or cost may be a barrier to them.
Yep.
So they're searching online. So we really wanted to provide a comprehensive solution for that group of people. And the Lexi Hearing, we believe, kind of hits that mark really well. I mean, the feedback we've gotten from this direct-to-consumer service and hearing aid provision has been extremely well. I mean, the reviews have been excellent. So let me just kind of highlight the main kind of components of how Lexi Hearing works. We provide a high quality digital hearing aid to these consumers at a very affordable cost point. It's a 16-channel device with directionality, with slim tubes, so it's also nearly invisible when you wear them. But what's really great about the product is that we've used all our digital technologies to integrate with the hearing aid. So someone who purchases the set of hearing aids, gets them delivered to their home, they download our Lexi Hearing app from the Android or the iOS App Store, and they then connect with the hearing devices via Bluetooth. Very straightforward instructions on how to set them up. And then you do a hearing test, the in situ hearing test from the app, directly, through the hearing aids. And we've validated as well, so it's extremely accurate. Once you've done the hearing test, you press program, and it programs your hearing aids exactly according to your audiogram. So then you have a fitted pair of hearing aids, but then we also have developed a climatization or a retention program, based on the evidence that's out there in terms of what do patients need to acclimatize to their hearing aids. And this is delivered through the app. So they get little videos, they get calls from the call center, and they have little activities that they participate in to help them get used to these hearing aids. We know that first week in particular is very important, so we focus there very much. And then we have a call center, a hearing hub with hearing experts. They're all audiology trained, and they provide support, not just technical support, but actually this hand-holding to help the patients get used to their hearing aids. They listen to them, and they can remotely program the hearing aids as well. So they can connect through the call center to the device and do fine tuning for these individuals. And then maybe just on the pricing side, what we've also done there is we've brought the cost down for the once-off purchase, but most people go for the subscription. So we have a monthly subscription. So it comes down to $49 per month. And that includes everything. The hearing aids, includes the batteries, includes all the disposables. So it's literally an all-in-one package. And we're the only and the first hearing aid provider that uses a behavioral incentive program. So the more people wear their hearing aids and we track their usage through the app, the more discounts they get. So we want to encourage healthy hearing habits. So the more people use their hearing aids, the more they can reduce their monthly costs and get discounts on accessories, etc.
Yeah, that's actually touching on something that we'll have to have a conversation, a broad conversation about that someday, because I think that is fascinating. And it's, again, one of these things that if you look outside of the industry, it's happening it's happening in a lot of different places. There was actually, before Google bought Fitbit, Fitbit had signed a deal with the government of Singapore, all around, more or less, wearing these fitness trackers, and the government kind of incentivizing you in a various number of ways. You get benefits, you get all kinds of different things if you wear it. So encouraging healthy behavior. But I do think that's a really interesting facet of this, is to, a lot of these hearing aids today, you can actually see a lot of the usage data of them. And again, this ties into where I think sort of the value proposition of the provider of the future will reside, is understanding what the kind of the usage of the hearing aid has been like, and talking through, why aren't you wearing them in this situation? Why are you wearing them in that situation? Because without that kind of data, you're sort of everything's just sort of on a, tell me about your experience, and it's at a very abstract level. But when you can get into the nitty gritty and you can see every day around 2 to 4 p.m., you don't wear your hearing aids. Why is that? And you can have a conversation about that. And maybe you provide some sort of you compensate in some way to make it so that for whatever reason, maybe that period of time is now a little bit more appealing to wear their hearing aids. So I do think that it's representative. I think these, the first step was Bluetooth connectivity, which, happened at the beginning of the 2010s in that decade. And now we've seen basically universal connectivity. So the next phase, I think, is going to be really fascinating, that now that we have the connectivity more or less in all of these different kinds of devices, and you have devices like yours that are much more accessible. I keep thinking about the beginning of the conversation where, you have parts of Africa that there's no way they could afford for the types of, products that exist. So we have to meet people where they are. And I think that this idea of a subscription model is pretty brilliant. I would not be surprised if that becomes a more prevalent business model moving forward with a lot of these types of items. I just think the subscription model, particularly when you factor in the ability to upgrade and those kinds of things, it just makes a lot of sense to me. So I know we're getting close here to the end. Any closing thoughts, anything that you want to say to professionals out there, consumers, patients, about the HearX Group and sort of like why we should all be keeping an eye on you? Because I think that even in the 5 years that you guys have been around, you've really done a lot. And I think that the pandemic has only, I think, highlighted the potential for the remote services and these telehealth oriented options that exist. So I'm keeping an eye on you, but curious to get your thoughts on like, what should we be keeping an eye on across the next few years with HearX?
Dave, yes, I mean, it's an exciting era, right? And COVID has, been a really negative influence on many different businesses and new in industries. In our instance, it's actually been a very fortunate, good time for us because, our technologies have just kind of fit in the gap. And you mentioned some of the big trends around teledoc and some of the telemedicine platforms. That's certainly the area where we believe, we can really make a difference in, and where we're already, playing with some of the big partners around the world in terms of providing our digital solutions there. We really see ourselves to reach this vision of healthy hearing for everyone everywhere. And that means, we utilize our strength, which is the fact that we're a digital hearing tech company. We specialize on digital hearing technologies. We have about 65 people working on these solutions at the moment. We have a call center set up to support patients. So we have these two divisions. I've shared the clinical part where we want to support clinicians with these digital technologies. But then we've also now launched this consumer business, and where we really believe we're kind of pushing some of the boundaries in terms of being innovative around both the financing models, but also the service delivery being comprehensive, utilizing the data we get. So we're a data-driven company as well. We utilize data. A lot of our technologies use AI and machine learning as well to optimize and improve the way in which we do things. And we really believe that's going to be the continuous trend as we refine, this platform. We believe, the Lexi platform is a platform that will continue to provide different types of hearing aids as well. It's not, the device is a small component of what Lexi is about. Lexi is a comprehensive care package that relies on a digital ecosystem. And we believe that's really kind of the direction that the industry should be moving. The technology is converging. So there's not so much difference between the technologies these days. It's actually the way they can integrate. And the way we can utilize the data to incentivize people. I loved what you said. It's not just about treating, but we want to incentivize healthy living and healthy hearing habits. And we believe with the way in which we can track the data, give people feedback through their devices, that's really the direction we're moving in.
Yeah, no, well said. This has been such an awesome conversation. Definitely need to have you come back on the podcast at a future date to continue the conversation, because I got a lot of things going on in my mind right now, just racing a mile a minute about some of the things that you said. And like I said, during the enterprise portion where we talked about a lot of the B2B services, I know a lot of my audience is professionals out there. And so I hope that really resonates with them, because I'm firmly of the mind that we as an industry are going to need to move in this direction, become more remote oriented. It's not to say, again, that the old way of doing business is going anywhere, but I think that we need to augment a lot of these things and be cognizant of, each approaching it as a piecemeal type operation where, little by little, you just slowly integrate these different services in there and you become a little bit more conducive to remote services. So Devet, thank you so much for coming on the podcast today. Thanks for everybody who tuned in here to the end, and we will chat with you next time. Cheers. Thanks for tuning in today. I hope you enjoyed this episode of Future Ear Radio. For more content like this, just head over to futureear.co, where you can read all the articles that I've been writing these past few years on the worlds of voice technology and hearables and how the two are beginning to intersect. Thanks for tuning in, and I'll chat with you next time.